So I mentioned this morning that I'd get a chance this afternoon to pretend to be a proper broadcaster, somebody like David Dimbleby or Fiona Bruce, and that's what we're going to be doing now, because we want to get beyond the headlines and beyond the surface of some of these issues in a debate. So the format will be, I'll kind of chair it, the first bit, and we'll talk around some issues and viewpoints. Then we'll open it up to the audience. Questions from the floor, but also questions that have been submitted online as well. And this is where the Mentimeter will come in handy. And if I could ask one of the team maybe to go to the green room, because like a true professional, I've forgotten the iPad that's got all the Mentimeter stuff on it, which I'll need later on. So it'd be very helpful if that could come. I knew I'd forget something today. But let's get ready for what's now been dubbed the big conference debate. So I'll come and join you if I can. Oh, oh, lovely. Right, at the beginning, I think everybody's got a mic, haven't you? So what I'll do is just ask you to say maybe a couple of sentences about who you are, what you do, and your initial thoughts about the topic of this debate, which is diversity without inclusion is not enough. So go for it.
I don't know. Yeah, mine is.
Go on, and you start.
I'll go first. Oh, okay.
And I'll play.
Hi, everyone. So my name's Pete. I'm the Senior Public Involvement Manager for Health and Care Research Wales. Been in post about 2 years now, so my role is to link up researchers with members of the public. So since I've been in post, my role is to sort of increase the diversity and inclusion within our public involvement community. So to answer the question, what does inclusion actually mean to me? I think from a public involvement perspective, it's giving the opportunity for everyone, no matter what background or demographic, to have a say and influence matters that directly impact them. It's changing practice, it's being flexible, and it's being accommodating to everyone's needs, and making sure everyone has the opportunity to have a say on matters, yeah, as I said, directly impact them.
Cool, who wants to go next?
Okay. I don't know if, yeah, mine's working. Hi everyone, I'm Tegan Brierley-Sollis, and I'm lecturer in policing, criminology and trauma-informed approaches at Wrecsam University. And it's just a great honour to be with you all today, so I'm really happy to be here. In terms of what inclusion means to me, I understand it to be diversity is about a mix of people, but inclusion is actually about the culture of bringing those people together and not simply including them, but ensuring that they feel valued, respected, and able to take part in decisions that affect them, and actually feel that they have a say and have an influence in all areas of their life. Thank you.
Good afternoon, everyone. My name is Faye Scott, and I am the founder and co-chair of the NIHR National Institute for Health Research Race Equality Public Action Group, and I'm also a senior public involvement manager. For me, inclusion means that I'm allowed to breathe, that I do not have to leave my identity at home, that I walk into spaces and I feel safe, that my voice makes a difference and it's not tokenistic. So to me, inclusion is really about living my true self and knowing that the essence of me is enough. It's enough.
Okay. Good afternoon. My name is Roiyah Saltus, and I'm a professor of sociology at the University of South Wales. Thank you for allowing me to be part of this debate, and I will give you an understanding of inclusion. For me, inclusion is intentional. I would hope that people will take away today the fact that to think about inclusion, to think of it as an active verb. It's something that you do. And for me, lastly, to think of inclusion, think of it in two ways. You're acknowledging and valuing difference, but you're also promoting equity. It can't be one without the other. So it has to be two-faced, and multi-layered.
Great.
Great.
So we all have met each other now. Let's start talking about it. I'd like to kick it off in terms of, I know you've been asked to consider a few things in terms of what does inclusion actually mean to you, but I want to kind of take it one step further in terms of, in the work that you do, in the kind of research that you do, and this is all about the people behind the research and making sure then, I suppose, that the research reflects that. How do you think about these things from day to day, and what does that mean for the work that you do? Could I start off nearest to me?
I think about it on a daily, day-to-day basis, and it's part of what I've been doing over the last 20 years. When I think of inclusion, I think of inclusive research, and I think of the work that needs to be done to make research more inclusive. I think of the population groups that I've worked with over the last 20 years. I think about their voices, their lived experiences, and I think about what has not been captured in their lived experiences and shaped into policy and practice. And so for me, inclusion is just one plank, and I think of inclusion, I think of diversity, and I also think of social justice and equity. And that's what I meant by it has to be multi-layered. I can think about including the population groups that I work with. I can think of inclusive research, but I also have to put it in that broader, wider context of structural inequalities. So I can't think of one without the other. And so that's how I tend to spend my work over the last 20 years, looking at how best to incorporate a more inclusive agenda in my research and in the research agenda taking place in Wales, but also how to, at the same time, be very mindful of the structural inequities that exist, and that will foster or not foster, encourage or discourage inclusive research agendas and inclusivity within the research that I conduct and that is conducted in Wales and beyond.
Faye?
So when I think about the research agenda, one of the questions I often ask of researchers is who's in the room with you? When you're having these ideas about your research, maybe it's sort of an idea that's been bubbling, maybe you've kind of floated and tested it with some colleagues, and you want to kind of conceptualize that into something that could be workable, something that's going to make a positive impact on diverse communities. Who's in the room with you? Who are you having, who's really in the room with you? So I'm not just talking about ethnicity here, I'm talking about beyond that, it's also the diversity of thinking, it's the thought process, it's people who are prepared to challenge your view of the world through your research lens. What does that look like? What kind of conversations are you having? So for me, part of what we have to do collectively, I think, in institutions, and certainly Peter and I have had many conversations about this, is unpacking those conversations and really getting researchers and those who are funding research to really think about how they are truly engaging people to have those kind of conversations. And it's got to be about challenging ourselves to think differently. And it's got to be about being humble and having a sense of humility, and cultural humility plays into this as well, because we cannot move forward with the research agenda and have a real tangible impact on communities if we don't have humility.
Can I ask you about that, Ben? Okay, I think everybody would agree with those sentiments, and that, you know, there's nothing wrong with that at all, and it's very important to do that. But practically, give us a practical example of what knowing who's in the room with you would mean in terms of doing a particular project differently.
Yeah, so
feel free to butt in at any time.
no, absolutely. So let's take COVID as an example. So we were in lockdown during the COVID period, and there were lots of conversations taking place virtually online. why is, you know, in terms of COVID disproportionality. So we knew that there was some kind of qualitative data. There was some sense that certain communities were being impacted negatively by COVID. What's going on here? And there was a kind of a light bulb moment for funders, regulators, researchers, everybody working in this space, thinking, I don't have the answers. I really don't understand why this is happening. So I need to have conversations, but actually the patients, the people who are predominantly disaffected by COVID, need to be in the room with me having those conversations. And so what did we have? We had numerous, I'm sure it was the same with you, Pete. We had numerous conversations online where you had regulators, funders, researchers, public involvement leads, and most importantly, patients trying to unpack what is happening. And that was a real realization that none of us have all the answers. And importantly, we need to be speaking to the people who are affected, and they need to be the ones sense checking us. They need to be the ones providing their insights and their intelligence. They need to be the ones telling us that isn't the way, actually. That way of engaging isn't going to work. Or you're making assumptions that are kind of, you know, not right. You're stereotyping communities. But we had to have those discussions to move us along.
Peter and Tegan, coming from your perspectives then as well, in terms of, I want to kind of make it real, if you like, in terms of the, you know, the practicalities and examples of where maybe people have missed a trick in the past and need not now. So carry it on. Yeah,
I just want to echo what Faye was saying as well. We want to encourage diverse thinking and sort of rebel ideas and move away from the echo chambers. You know, we're all different people in here, but we all have similar interests. We're all interested in health and social care research. We're all employed and we're all, you know, working towards improving research in health and social care. But we want to work with and involve people who don't necessarily have an interest in this. It's not something that they have thought about beforehand. So we, along with the Wales COVID Evidence Centre, we went out and we did some focus groups and workshops with the 4 most impacted community groups by COVID, which was disabled people, people of colour, children, young people, and people from lower socioeconomic backgrounds. This works, we identified the research priorities, what they want answered from COVID, what they want to research, look into, and this is fed into the Wales Evidence Centre. So, yeah, so we want to move away from echo chambers, get different people involved. I should really get commission for this, but there's a great book by Matthew Syed called Rebel Ideas, and it's got tips and practical examples of how to encourage different people to have the same voice in the room. So we want to remove that power imbalance and have an open platform, an open space for everyone to feel comfortable. So if anyone wants to read that book, it's really, really good. So I do recommend it.
Tegan, in terms of your own work, how do you approach these issues?
Well, my work centres around individuals who have experienced trauma, and nobody is immune from trauma, and everybody in this room has their own stories to tell. And what I found when I conducted a piece of research on the emerging trauma-informed culture within youth justice, I was interviewing children who had their own stories and experienced their own traumas. And I was interviewing practitioners, and they would have also had their own stories and experiences to share. But we all have expertise and experience, I think, and we can bring our own lens to all of these different issues. So practically, when we're trying to create meaningful inclusion, I think it's important to create psychological safety first and foremost, so that people feel able and safe to be authentically themselves. And there is a difference between being safe and feeling safe. We could all be safe in a room, but if we don't feel safe, we're not going to necessarily feel able to say exactly how we're feeling about something. So we should create psychological safety. And there are various ways of doing that, and there are quite simple ways of doing that, and it involves respectful communication, thinking about our tone, thinking about the language that we use. Always thinking as well about how somebody's behaviour is a form of communication, and thinking, well, what is it that they're trying to tell us? Maybe they don't feel able to articulate it, or maybe they don't feel comfortable, or maybe they just can't find the words, especially when we're talking about children, and they might not really understand, well, they will understand what they're feeling, but they might not feel able or safe to say it to you until you build that trusting relationship. And so I think that's really important. And I think the other key thing with psychological safety is recognizing that people are not hard to engage. People have experienced things that make it difficult to trust, and we have to give them the time, because that is what we owe them as researchers. They are giving up their time for us, and that's a precious gift. So the least we can give them is our time to really get to know them and build these good relationships with them so they feel safe with us and able to share their stories.
Okay, well, what are the barriers then, in terms of getting where many of you would argue we need to be on this issue? Is it a historical one, the way things have always been done? Is it the way research is funded? That we heard this morning about it could be more random, maybe certainly more level. Is it the researchers themselves? They're too similar to each other, or too similar to what's gone on in the past? Is it people like me, the media, that maybe don't take enough of an interest and to translate the new things that are happening into things that really do interest people and think that are important? Is it a combination of all of those? And please chip in on this one in terms of what's holding us back.
I think there's loads of barriers why people don't get involved or why don't participate in research and stuff. There's the trust element, there's feeling safe, talking about their opinions. There's also, for like researchers, is there enough time to build up that trust and rapport? So I think you can't nail it down to one barrier or a number of barriers. I think there's a whole systemic thing that needs to introduce and change when you are building up trust with public members, and it does take a lot of time. It does take a lot of time, patience, also trust with the public members. So there's a few sort of not strategies, but approaches that we've kind of used in the past. So it's going out to these community groups and to the public members where they do feel comfortable. You know, we don't expect them to come to us. I think that's not going to work. There's a user design, which is public involvement. So working with public members to design the involvement as well. So what's suitable for them. You know, if we're looking at working with children, young people, we're not going to have it Monday to Friday, 9-5. We've got to think about, do we need to do it outside of working hours? Do we need to do it on the weekends? We need to be flexible and accommodating. There's also influencer engagement, so working with community leads and building a trust with them, and then also trusted engagement. So this is partnering with other organisations who work with these community groups and building up trust that way. So it's not a one-size-fits-all approach, and there's no one solution to tackling this, but I mean,
I'm going to ask a really kind of journalistic question, yes, sorry, because the theme this morning is sometimes you ask simple questions on complex issues. But if there was a starting point, a kind of quick fix here, I know there isn't, okay. But if there was, you know, if you could wave a magic wand and say, you know, this is one little thing that will really help out in this sphere. Or is that the problem? There isn't.
Okay, let's switch it up. Let's not look at barriers. Let's look at opportunities.
Yeah. Okay.
Let's do that. Because there are a lot of opportunities. You saw with the pandemic that systems can change overnight. Now, I know that things have, in some cases, reverted back, but I do hope that we can take on board the fact that systems can change, and they can change very quickly. And so I think one opportunity will be to look at how can the system, if it can change during, obviously, the pandemic, can it change in other ways? Funding is fundamental. Looking at the way funding is allocated, who is allocated to, is fundamental. We want to have a more inclusive research environment. We want to have more inclusivity in regards to who takes part in research. We need to find out where those people are. For instance, there are top-tier universities that receive a lot of the research funding. There are universities who are not in the top tier, who have a significant number of faculty, staff, as well as students who come from diverse backgrounds. That's one segue into being able to look at a different type of research funding regime. we have, so that's, the whole idea of the funding streams, I think, is important and definitely needs to be looked at. This is when the one side of me says, how controversial do you want to get? The other side says, let's just leave it at that.
Go on. We're amongst friends here.
And then there's I was in a workshop this morning, and members of the public were saying, look, my work, my labor, my lived experience is embodied, and it's labor intensive and can be emotional. Why isn't it that I'm not recognized when it comes to the payment of people who you would want, members of the public who you would want to be involved in research, in all stages of the research? So when we go towards funding and funding grants, are we taking on board those issues? How best to properly fund and pay and recognize the embodied expertise that we also call the lived experience. So I'm making the case that a lived experience, you wanting people to come in and share their time, you're talking about an embodied expertise that needs to be recognized. I come in, I'm recognized for my areas of expertise and paid very well for it. The person who's coming in with a lived experience should also be recognized. So it's things like that. And I know that things have gone on and there are developments, but being able to see that as normal, as part and parcel of how you engage with a diverse population base.
Quickly, anybody else on that? Maybe not barriers, but opportunities.
I was just struck by what you said about this, the valuing of the public members who are involved in research, because I think that's a real fundamental aspect, and particularly when you're looking at communities who have been, let's be frank, and it's well documented, harmed by research, that's sort of well documented. And so what you're dealing with is a sort of a legacy, that's the backdrop that you're dealing with, that's still kind of very current in people's minds. And it's kind of then, if you like, built upon by poorer health outcomes, people feeling that they're not being heard, listened to, respected, kind of, the outcomes in terms of health and social care generally tend to negatively impact on particular diverse communities. So that's the kind of the backdrop. But I think that valuing piece also needs to look at not just in terms of payment. So within the NIHR, we have a payments policy for how we pay public contributors, and we're really clear about that. And we're really clear about making sure that we flex it so that it works for the diversity of ways in which public members get involved. So it's not just participate in a clinical trial or a research project. It's no, how about co-delivering some training? How about sort of facilitating a seminar on, an aspect of health and care? How about, which is what some public contributors are going to be doing in November, facilitating a discussion with directors about diversity and public involvement and challenging them about their own practice. These are the kind of things that we need to be doing. And they want to be valued, not just in terms of monetary terms. This is what they told us through our recent listening exercise. They said to us, I want the whole of me to be valued. I want you to recognize that I don't just bring my disability or disease burden. I'm a whole person. I have professional expertise. I have lived expertise. I have richness. And actually, I haven't been feeling well the last 6 months, and getting involved in this is going to help me think about how I can develop myself and promote myself in terms of other projects. So it's about valuing that whole individual, not just in terms of the monetary piece. And certainly that's what our public members have told us. So I think there's a wider area for us to think about there.
Tegan, do you want to add anything before we go to a question that we've had on the chat?
Well, it's just to say we have a really, I think, good practice at Wrexham University. We have a group called Outside In, and they are all individuals with experience of health and social care services, and they are heavily involved in our social work programme at the university. So they are involved in module delivery. They're involved in research, but they've also recently been involved in contributing to a book chapter or a few book chapters in Social Care in Wales book. And one of the members also designed the front cover. And we had the most beautiful book launch where they came along and everyone was talking. And the great thing about the book is it incorporated the voices of academics and researchers and practitioners, but it also incorporated voice of lived experience as well. And what we recognised was that many of the academics involved and the researchers all brought their own lived experience as well. So it wasn't a kind of them and us. It was everybody together, all of us together in this safe space. And that was, it was just a really lovely key moment, and a really, it's good practice that we're replicating across the university and in our nursing and allied health programmes, because it's worked so well for so many years. And we are #1 for social inclusion, so I think that's probably one of the reasons why. So we're very proud of Outside In.
Right. In a minute, I'll come to the floor. Oh, it's not the floor, isn't it? The floor's down there. They're all up there. But we have had a question from Kerry Hood, and I think it leads on in some degree from what Tegan said there. The question is this: I am concerned that the work in inverted commas of it's basically, if I remember the question correctly, it's that the work of trying to bring inclusivity into research falls to those researchers who themselves are from marginalised groups. The question was, how do we make it everybody's job? Who wants to go?
Okay, another opportunity that we have is that there are a lot of models of engagement that are in play. There are a lot of, for instance, last night I was looking at an equality assessment tool that is used to look at research and research design. So it's something that you have to submit when you're submitting a grant application. Alongside that comes this form which you fill out, which makes any researcher who would want funding from that organization look at the impact that piece of work is going to have on a range of different people from various protected characteristics. Now, I say that to say that that is one way when you start to get researchers looking at their work in a particular way. I, based on a number of reasons, look at my work in a particular way. And so, yes, that comes with an additional burden. But to be able to spread it so inclusivity is every day, regular, there are tools and models already out there that could be used. So that's one way, finding out what value your research has as part of the research funding regime.
Okay. Anybody else on this?
I think it's like sharing the benefits of diverse opinions as well. This evidence is clear that diversity and inclusion has a positive impact on research, whereas creativity, innovation, and performance. So it's sharing the benefits and highlighting how important it is to involve different communities, different perspectives, different diverse backgrounds into the research process. I understand I didn't answer that question, like how do we encourage everyone to do that? If I knew the answer, I think we wouldn't be having this discussion about diversity and inclusion.
I'm going to swap mics now, because I'm using at the moment one of the roving mics that we need for this next bit. So I'm going to hand this back. I'm going to grab this one, which I hope now works. So, yeah, your go. Questions, please.
And comments. Not that I'm taking your job.
No. Questions, comments, viewpoints, controversy, anything you want. Oh, there's one in the corner.
Hi, thank you. I just wanted to pick up what you were saying about COVID, and one thing that really stands out for me is I went through my life, most of my life I was healthy and fit, and then all of a sudden I became disabled, and COVID was actually, it put the disability and all the problems that went with that on the map. And I suppose my question and what I'm trying to say is, now I'm in that position of being disabled, I'm medically retired, I had a career in the NHS for 33 years that I had to give up, is that there are challenges with engaging with inclusivity with people that are disabled, like myself, because if you look at me and think, well, you know, she's fit and active, but not knowing, you know, all the complexities. And I think what I found is even now, it's getting better, but I think a lot more work needs to be done towards including disabled people in research, and also looking at things like reasonable adjustments, looking at things like venues. Is this the best venue for, I'm not a criticism, but I suppose I'm a bit passionate about it now, because I've gone from being the healthy, professional NHS person to now the disabled, vulnerable patient. And I think that voices could be heard a bit more from disabled people, and I just wonder, as a group, you know, how do you see that going forward, and what are the challenges, especially with hidden disabilities?
We'll take that question. There's one, I just think, behind you as well, so we'll just take 2 questions in one go if we could at this stage.
Hello, I want to pick up on 2 things. First, that the lady on the end said about everybody has lived experience. It's not something weird about patients. We're all people. Everybody has lived experience of some description or another. And it's about sharing and learning from each other and valuing each other. And then what the lady has just said there, yeah, this venue has been a real problem for me today. My day is 11 till 3. I've been here since 8:45. I'm leaving at 4. So that's why I keep sneaking in and out. So I'm sorry about that. But, you know, when you're organising an involvement opportunity, think about, ask people what time suits you and try and find a compromise, and what venue suits you and try and find a compromise.
Excellent. So a couple of points there on, you know, the disability, people with disabilities, and then actually just creating the right environment for people to be getting involved. Would you like to pick up?
Yeah, thank you very much for your question and your reflections about hidden disabilities. I think that's a real challenge, because people have to feel safe disclosing their hidden disability. So we do a lot of work with public members who have a range of visible and non-visible disabilities. And what I try to do in my work is create those safe spaces for really open and honest conversations. But it's important to stress that, and it touches on the point that you made earlier, which is so important, there's a real relationship building and trust building piece that has to take place over a long period of time. So that's an investment that has to be made. And not only sort of do we have to make it, we have to sustain those relationships when we make those relationships, we build the trust with the communities. And then we need to create safe spaces to have honest conversations. So, for example, within the Race Equality Public Action Group, we had a lot of conversations about COVID, because I joined the organisation during the height of COVID. So that was very topical. But it led to a lot more conversations about other areas of health inequalities, and also talking about non-visible disabilities, and particularly mental health, because it was felt that kind of people's mental health was really being impacted by COVID, the isolation factor, the fact that people weren't able to kind of participate in their kind of face-to-face groups, support groups, peer groups, etc. So we do need to build that trust, create safe spaces for open and honest conversations, and not make assumptions about what reasonable adjustments people need. Because I'm working with 2 people who describe themselves as blind. That's how they describe themselves. That's not my... And they say to me, this is what I need to be able to participate. But it's very different. Very, very different. So we also can't make assumptions. We have to take it on a case-by-case basis, have that conversation, build the trust, understand what people need, and then put those reasonable adjustments in place.
Anybody else want to
on those specific
Yeah,
points?
if I can come in. So we're doing a piece of work at the moment with allyship events, and it's working with underserved community groups to how do we make our public involvement more inclusive. And this stemmed from a conversation me and Faye had back April time. It was a while back, yeah. So in Health and Care Research Wales and the public involvement, we've got a EDI advisory group, and we've got public involvement members, researchers, practitioners, and policymakers from all organisations throughout Wales, of which we've got Disability Wales, so we've got a practitioner and a policymaker part of our advisory group. From this, it stemmed that we've been able to do allyship events for them, so we met with Disability Wales and we talked to them about, you know, what more can we do in Health and Care Research Wales to make it more inclusive and to involve them more in research. And the main outcome from it is more of a user-centered approach. So working with that individual and asking that individual what support do they need, rather than Disability Wales, you're a disabled person, you're a wheelchair user, different to another wheelchair user. So it's adopting a user-centered approach, and that's what we're doing at the moment. We've got other allyship events that we're working, that we're meeting with, and we've got a joint event with NIHR on the 15th of November. So there's work going on behind the scenes, but we're aware there's more that we need to be doing. And any advice and any guidance that you want to give, our email's always there. So if you want to just say what support that we can provide you, then yeah, that's it. Thanks, Dale.
I was struck actually by in the middle of one of the questions, you know, there's some assumption maybe that people with lived experience, which is all of us really, isn't it, are somehow kind of odd, you know, and because, and I only ask this because when you're telling a story, which we have to do, if I was doing a news piece on something, the first question somebody in work would ask is, where's the real person in this? Where's the case study? At the top of the piece to explain and bring it home to people what exactly I'm talking about. Has there been a temptation to view lived experience as some kind of something quite bizarre?
I think, well, for me, I'll give some of my own experience because I suppose if you'd asked me maybe 3 years ago to tell you about myself, I would completely ignore any of my lived experience and just shut it away and hide it in a box because I felt like people would maybe not think that I was professional, and I couldn't be professional because I'd been through these different things. But now I see it very differently. I see it as it's part of my identity. It doesn't make up the whole of my identity, but it's part of my identity, and there's pride in that for me. So for me, 10 years ago, I was homeless. I was living on the streets, and I was invisible, really, in my eyes, because nobody would look at me, and I didn't really exist to anybody. I wasn't getting that love. I wasn't getting that nurture. And then I would never have guessed that this is where I'd be, you know, in 10 years. It would never have crossed my mind that my whole life could change because of research and because I became a researcher and because I invested in my education. Again, not something that I would ever think that I would ever do, because I just felt like it wasn't for me. When that 10 years ago, I felt I'm never going to go to university. I'm never going to be like everybody else. I'm just, you know, this is who I am now, and no one will ever pay any attention to me. And I didn't get that. And there's a really great quote by Luis Cozzolino, which is, "We're not the survival of the fittest, we're the survival of the nurtured." And I've been so lucky that in the past 10 years, I've had amazing people that have actually nurtured me and have led me to where I am now, including my PhD supervisors who believed in me when I didn't believe in myself. And I think we can do that as well for other people. There's nothing odd about what we've been through. It's just our journey. It's part of our story. But one little crack in our mosaic doesn't ruin the whole piece, and it just makes it even more beautiful. I think it's part of who we are, and it's something that we can embrace, and we can use the stories to hopefully help other people who might be in the same situation.
Okay, a couple of questions just to move things along a little bit, or comments, or whatever viewpoints you want to say.
Hello. Oh, hello over here.
Yep, lovely.
I was just wondering if I could find the panel's view about if there was a population in Wales who didn't have access to interventional trials that could save their lives, and if they got diseases, then had to travel hundreds of miles to get treatment or interventions or join trials, would the panel think that was fair?
So if there's a population in Wales that has to go very far to take part in those trials, is it fair?
That's a leading question, because it is not fair. I think what you're doing is raising the issue of that we need to look at a range of different social inequalities, and one of them is linked to place and geographical location as alongside.
It was more related to if you look at the centres and units in Wales, they are adult directed. The social care units do cover paediatrics and children, but the interventional centres like cancer, heart disease, neurology, all the rest of them, they are not centred at children. So if your child's dying from Duchenne muscular dystrophy, you have to go to Newcastle. No trials for you in Wales. Not happening. So my question is that strikes me as unfair. Does the panel agree?
Any more on that one?
It's profoundly unfair. That's the starting point, and how do we address that would be the second point. Yeah, I can pass over.
Good.
But you're absolutely right in raising that, and it's this whole idea. But I guess for me, they're looking at things from an intersectional lens. So looking at, you've highlighted age, you've highlighted location, you've highlighted a whole range of different things. And so we're looking at inclusive research. We have to look at it not just, okay, who are we bringing in, but who remains out and why.
Does anybody want to add to that answer? How do you go about that? The distance and a population paediatrics then, obviously not all research can happen everywhere all at once. How do you practically solve an issue like that?
Were you listening to a conversation I had earlier? Because I spoke to somebody who was talking about something very similar. They were saying how during the pandemic, people were able to go across borders and work collaboratively, but since then things have reverted back to norm, whatever that may be. But how with the pandemic there was that opportunity to think differently and put in place different systems and to do things differently. And I think we're losing that.
Is it too late?
Well, no,
is it too late not to take advantage of it? Nobody would wish a pandemic on anybody, but in terms of a huge amount of how the health service worked and research and so on and so forth, there were lots of gains. Do you think there's a risk of the opportunity to make use of that disruption is slipping away, and why?
I don't necessarily think it's slipping away, not from the work that we've been involved in, because we're actually looking at sort of kind of local place-based approaches in terms of community-led research. So that's kind of the conversations that we're having within our organisation. And I think COVID opened up a lot of opportunities to work sort of across the nations, actually, all of the nations. And we've been doing a lot of collaborative work with Wales, with Scotland, with other places, but also in terms of that reach of public contributors, that you could be based in Manchester or Stafford or York or Scotland, and you could still dial in and have a conversation and be part of the discussion about health and care research that matters to you. And I think we need to sustain those relationships that have been built. That was my sort of previous point, that we've got to build on those relationships and sustain them and maintain them. And even if there's nothing, we're not doing anything kind of proactive that may be of interest to people, it is about keeping that relationship warm, because we never know when we're going to kind of need to draw upon those skills and insights and help us kind of co-design approaches in the future.
I want to take one more question from the hall. Or, yeah, there we are. Sorry.
Hi.
Very bright
Thanks.
here. I can't see anything.
Don't like the sound of my own voice.
So we'll take both questions,
Okay.
I think.
Thank you. Thanks, everybody. It's been really interesting listening to everybody's views. I just wanted to take us back to the previous question that didn't really get the sort of, you know, the response about, you know, every study open everywhere. And unfortunately, that's just not possible. You know, we're talking about complex studies. The most important thing, personal view, is that a patient is able to access that research. Now, it's, you know, in instances where they have to travel to Newcastle, you know, the facilitation of that is what's important, because, you know, unfortunately, for some studies, for rare diseases, etc., there will only be one place in the UK that's actually running a particular trial. So how we work together to make sure that patients can access research projects is really important, and we've got very good examples of looking at novel ways to deliver research where we've seen very, very good inclusivity, ethnic diversity when we delivered studies during the pandemic, or post, you know, sort of the middle of the pandemic, whereby we run it in a trial in a centralised way, so that we didn't expect patients to come in from all aspects of ways to be recruited. They were recruited at home, so we had a really good mix. So it's looking at those ways to make sure that we include, you know, a vast, you know, as many, a diverse as possible population in trials. So I just think we need to be mindful, because we can't run everything everywhere, because we just can't, because we haven't got the, you know, we haven't got the funding to be able to do that. And actually, for those studies with novel medicines, the pharma companies certainly wouldn't be able to do that. You know, we've got limited drug supplies, and we need to make sure that they can be delivered at site. So I just wanted to pick up on that, really.
Okay, any response to that as the mic goes further up the stairs? We'll get this question first, and then we'll come to you, if that's okay.
Yeah. Oh, sorry. Yeah. This is really sort of interesting debate. But I think the problem half the time with inclusion is that people don't recognise that inclusion affects them. It's always somebody else's issue. And I think what people need to start realising is that everybody can be excluded at different points in their life, and everybody's life moves through a process, and at different points they will be suffering exclusion, and at other points they'll be embraced by inclusion. But it all needs to be understood in a mix, and I think that's maybe part of the interesting dynamic that needs to be picked up on this debate, because everybody's going to be affected by inclusion at some point in their life, and we need to get to grips with that.
Thank you very much. Hold the thought on that one, as we just get one more question in from here.
Oh, hi. It's not really a question, it's about responding to your statement. During COVID, what happened was we were willing to listen to each other. Everybody was open to different views or points. I was listening to lectures from the US, from Canada, from China. The world opened up, and we were willing to listen. And I can see slowly that world is closing again. And it doesn't matter how many EDI groups we have, unless things are actually practiced, people are given support to put policies, action policies, follow up, measure impact, then nothing will change. We will go back to back to stop listening, back to being competitive, less collaborative. It's just to add to that response.
A couple of points raised there, if somebody wants to take them on. Tegan?
Yeah, sorry, do you want to go first? It's just a couple of points around some of the questions made. I think it is very multi-layered when we're thinking about inclusion, because what we should try and do is create a culture of understanding, and that means understanding everybody and understanding that actually organisationally we should be looking at it through a multi-layered lens. We should be looking at previous underpinnings of the organisation, and actually how that might affect the running of it now, and how that might have an impact on inclusion as well. So it absolutely has to come from everybody. Everybody has a duty to make spaces safe, create this culture of understanding. But actually, it takes a lot to work together and to actually think, well, you know, maybe previously an organisation has been very risk-driven, and when you're trying to move into a culture of understanding, you have to take a bit of a step back and start thinking about it from a strengths-based perspective. But we have cultural hangovers, unfortunately, and that means that those things still have an impact. So there can be challenges that we experience from that. So it's about always being reflective and thinking, you know, each day, well, what might have changed in society, and how can we do better? How can we learn better? And how can we include and involve more people, more voices? And are we actually listening to ourselves as well, and listening to those around us? And again, it comes back to psychological safety and embedding that within each layer of an organisation, because that's really where people start to feel that they can be themselves. And as you said, Faye, at the beginning, where you feel like you can actually breathe, you're not leaving a part of you behind. You're bringing everything there to you, and that makes up the spirit of the organisation. It's the people that work there, the people that come in to the service, that makes up the spirit, the personality of the organisation. So it is about creating a culture of understanding.
Just 2 points. I can only amplify what Asher said in regards to being able to establish a strategic framework, monitoring framework in this area. That's the first thing. The second is that it's important to note and to commend those organising this conference that we are still talking about this. I was chair 2 years ago of a similar panel, and so we're still having the conversations, and we're still making them centre stage in the work that we're doing and the research agenda in Wales. And I think that's important. You know, when people are saying, okay, well, this is important enough, and it is important enough, this is my life's work, but important enough to have a conversation in the middle of a conference about does it matter and how best to move forward. So those are my final 2 points. So
Okay, we've got just under 10 minutes left, maybe a tiny bit less, but I'm going to use the Mentimeter, because I've never used the Mentimeter before. So we'll give it a go. There have been 45 responses during the day on the question, what does inclusion mean to you? Beth mae cynhwysiant yn aelodau chi? I won't read all 45 responses out, but I'll give you a flavour of what's been said. And there they are on the screen. So you've got, we just heard about psychological safety. Somebody said psychological safety, to be accepted for who I am, including communities from beginning to end. Openness, positivity, uncharted territories, shared rewards, shared risks, deep reach, wide focus. We're all in it together. My voice is listened to, being heard. Fairness. What would you put in the Mentimeter? And do you agree with all of those?
Yeah, I definitely agree with all of these. I would potentially say for researchers and people looking to involve underserved communities is be the novice again. You're experts in your research, but you're not experts in these underserved communities. So ask questions. And Athro, you mentioned earlier that you're involved in these communities, and you go out. You've been involved in charity for 20 odd years and stuff. So put yourselves in the situations. And Faye mentioned earlier as well. Like, practicing what you preach. So yeah, be the novice again and don't be afraid to ask questions.
Would somebody like to take it on from there?
I think I would just add, I agree with all the points that have been made, and I think I would just add the importance of understanding and checking your own bias, because we all have kind of biases towards people, and it's about being aware of that and checking it, because it has fatal consequences. Because the work that we do changes lives, and we can change lives for the better or for the worst. So bias is something that we have to be really, really cognizant about and think through. When have I been told that actually I've been a little bit dismissive towards particular individuals? You know, when have I been told that I need to think a bit more culturally aware in the use of my language? So we need to check our own bias, be aware of it and check it.
Any more on some of those concepts or ideas or thoughts?
I love them. If I had to contribute, I'll probably put equity, I'll probably put rigorous research, meaningful research, things like, yeah, that I think would be important to me, because sometimes there has to be the link between inclusive research and good rigorous research. The two are like this. So when you're looking at the research that you're doing, making sure that it's impactful the way that you know that it needs to be, and in regards to that wider EDI agenda, I think is important.
Drawing to a close now, could I ask you all, it's a similar question I think I asked earlier this morning, about bringing it to life, making it kind of tangible almost in the real world. There's about maybe an example you point to or can point to of what good, really good looks like, and what difference does doing it like that do? Could each of you perhaps think of an example and explain it a bit to me?
I would like one evening to receive an invitation to review a grant application. And that grant application will comprise a number of documents. And one of those documents will be an outline of the proposed study, bog standard, fine. Another document will explain to me the importance of this study from a range of different protected characteristics and the impact that particular study is going to have on society. I would also like that person who is, or group who has submitted that, would have had a guidance as to how best to look at their work, their beautiful project that they think is so important, look at it and be able to assess it based on a number of different criteria. That's what I would love to see. That's how I could spend a weekend looking and reviewing that document, both the proposal and the intended impact and their reflection on how their study, which is going to be conducted in the world, so it's going to be imprinted by a whole raft of different inequalities, is going to really, really make an impact.
Thank you very much. Moving on, Faye.
So we've been involved in working in a collaborative, which and that collaborative came about through the Race Equality Public Action Group. So the Race Equality Public Action Group is made up of public contributors, senior NIHR colleagues, and members of the academic and health communities. And when we were co-producing our strategic plan, one of the things that was mentioned by one of the public members was that we should produce a race equality framework for supporting researchers to become more racially competent in their work. And not just researchers, but also it could be PPI leads, anybody with an interest in involving members of the public in their work. So it could be within research, but also broader than that. And that piece of work led to partnering with wider communities, to design the framework and also partnering with a number of research institutions to test the framework. So that collaborative now is a community of practice involving over 20 organisations, including a global private sector organisation, local authority, NHS Trust, universities from across the UK and Scotland. So, and that's in partnership with communities. Everybody who was involved in designing that framework is now taking forward the work. And that has led to a shift in cultural practice within organisations. So they have delivered training, they have changed the way they do surveys, they have set up PPIE groups, where patient public involvement groups, where they never existed previously. They have recruited staff into roles to support the development of their strategies around public involvement. So a lot of change has happened, and that work continues.
Peter?
Yeah, I don't really do public involvement anymore. I sort of sit back away from it. But if I talk about my previous role, so some practical examples. So I was working for a children's and young persons research centre called Decipher, and we've got a youth advisory group called Alpha. These Alpha sessions will run in the evenings and weekends when it's suitable for children and young people, so they can come along outside of school hours. So there's a practical example then. Speaking earlier to a lay member from the Prime group, Lindsay, so she's able to feed back on research collaboration in her own time and short, concise meetings. So it's being flexible and changing the way that people collaborate and feedback on research studies and participate in research as well. So it's not a one-size-fits-all. Just because you can't make the meeting at a certain time doesn't mean you're not able to feedback on it. So think about different ways to collaborate. And last but not least, Tegan.
Thank you. So I mentioned our outside-in group earlier, and I think that's a really good example of some good practice. But the other thing that I wanted to mention is a collaboration between ACE Hub Wales and Traumatic Stress Wales, and they created an expert reference group to create the trauma-informed framework for Wales, which was launched last year. And from that, there has been a community of practice formed, a national community of practice, but also a community of practice in North Wales. And lots of different organisations are involved in the community of practice and bring lots of different strengths to the practice. And also, what that framework has resulted in is materials being produced, public-facing documents being produced, which can then help other organisations who are on their journey to becoming trauma-informed, where we can all learn from each other, so we can learn what's going right for people, what might have not gone so well for people, and how can we make that better. So we have policy and practice guidance, sensitive communication guidance, physical environment guidance, which also includes psychological safety, because as I said earlier, you can have the most beautiful room that you would think you would be safe in, but you actually have to feel safe as well. So actually it's learning from each other, and those community practices are really, really strong and have lots of wonderful contributions from various different people and organisations.
Brilliant, thank you ever so much. Can I thank you for being a brilliant panel, for helping me out a lot on this issue. I've learned a huge amount, which is a good thing. Thank the audience for their comments, and please could you also thank the panel.